Thank you for having me here. I'm excited to talk a little bit about the data that the Administration for Community Living has. We are an operating division within Health and Human Services. And by way of an overview, ACL, the Administration for Community Living, started in 2012. Previously, we were the Administration on Aging, and then the Administration for Intellectual and Developmental Disabilities joined with us. And since we have had other agencies come into where we are. And so our mission overall for all of our agencies and subparts is to maximize the independence, well-being, and health of older adults, people with disabilities across the lifespan, their families, and caregivers. And so our agency promotes strategies that enable people to live their lives in communities, live how they want, where they want, to be able to achieve the things that they want to achieve. And we're made up of a number of different program offices. One of them is the Administration on Aging, and it carries out the Older Americans Act of 1965 to promote the well-being specifically of older individuals by providing programs and services to help them live independently and in their homes. But there's also a segment that looks at adult protective services, exploitation, neglect, and financial abuse. And we recently, under AOA, obtained the Senior Health Insurance Programs, the SHIPs, from CMS, and we're piloting a national data system for adult protective services. Another big program office that we have is the Administration for Intellectual and Developmental Disabilities. And that provides financial and leadership support to organizations that exist specifically for people with developmental disabilities and their families to obtain the supports that they need and want to be able to live in communities. And very recently, I think as of 2 days ago, officially OMB has approved that the National Institute on Disability, Independent Living, and Rehabilitation Research has joined into as part of ACL. And NIDLR, as it's called, is to generate new knowledge and promote effective use to improve the abilities of people with disabilities to perform their choice, their activities of their choice in their communities, and expand society's ability to support those choices. As far as data, I will talk mainly about AOA and AIDD because NIDLR is so new with ACL. At this point, we're not entirely sure which data we will be making publicly available and how we will be making it available, so stay tuned for that. But as far as AOA, we have two main ways that you can get to our data. We do submit to data.gov, but separate from that, we do have the Aging Integrated Database, and that provides information about the AOA Title III, Title VII, and Title VI services, which are supportive services for older adults, for tribal communities, and for protection against abuse, neglect, and exploitation. And we also, in the AGED system, as we call it, have census data. We get a special tabulation of data because our population is primarily 60 plus, and a lot of the other populations are 65 plus. And so we have a special tabulation that includes that 60 to 64-year-old population. And using AGED, you can download information about our services and the census data as you want. We also are part of the Federal Interagency Forum on Aging-Related Statistics, which produces the Older Americans Key Indicators of Well-Being. Every 2 years it was, and now it's moved to every 4 years, and that's available through agingstats.gov. And there are 36 indicators of the lives of older Americans and their families, including population information, economics, health status, health risks, and behaviors. And the data are available in tabular format. There's a book that comes with it, but all of the data are also downloadable in Excel format through agingstats.gov. And there's a lot of information also available through the Administration for Intellectual and Developmental Disabilities. The National Core Indicators Project is a project that has standard measures that are used across the participating states to assess the outcomes of services that are provided to individuals and families. And there's a section for older individuals and individuals with disabilities, and a separate section for individuals with developmental disabilities. And there's information on key areas of concern, including employment, rights, service planning, community inclusion, choice, health, and safety. And so on that website, you can download and look at that information. There's also the state of the state that's administered by the University of Colorado to investigate determinants of public spending for intellectual and developmental disability services in the United States. And they have longitudinal information about revenue, spending, and programmatic trends at the state and national levels. The Access to Integrated Employment is a project conducted by the University of Massachusetts, and it's been in place since 1988. And the statedata.info is a website that illustrates service system investment in day and employment services, and realstories.org has more qualitative information featuring stories of youth with intellectual and developmental disabilities that are in paid jobs in their communities. And last but not least, the National Residential Information System Project, RISP, is conducted by the University of Minnesota, and it presents annual state-by-state information and national statistics on residential services for people with developmental disabilities, and it includes state and non-state institutional settings and community and home-based residential services. And I can say on behalf of ACL, we are very interested in having people use our data that's available, but also we try very hard to work with organizations and networks of providers and governments to link people to the services that they need in the most easy, accessible way. And so having systems that link that information so that if an individual comes for a service, contacts any of the agencies or service providers, behind the scenes, all of that information is connected so that that service provider knows what other providers provide services that that individual may need, knows what that individual may have already received, and be able to provide seamless service. That's really what our goal is. And so I thank you for your attention.